Welcome. Welcome, everyone. I am really excited about this month's HSPN webinar for the OHTs, and I'd invite you to let us know where you're joining us from by your name and the organization. Please be sure that you check it to everyone. And I will look forward to seeing who's joining us already. I see people are signing in and joining us fairly quickly. Welcome, Bushra from Nucleus, Mario from Chats, Leslie from Rise, Chinwei from the MOHT. Welcome, Chinwei. I do a little work with the MOHT. I get to see Chinwei from time to time. Sandeep from Closing the Gap, Roya, and here's where they start to fly. Shelley from that is Muskoka, an area. Muskoka Amalgwin, I believe, is the new name, if I pronounced that correctly. Hi, Andrea in Dryden. Sarah from the Ontario Health Team Niagara. Zoe from Waypoint. Shelley Lee from Hastings. I'm sure people are finding the chat and being able to introduce yourself. Please do. It's really great. We can't see each other on this, so it's really nice to know who's part of the conversation today. Really appreciate it. And whether or not you're from an OHT, if you're from Ontario Health or the ministry, I know sometimes we have people joining us from all of the different organizations that support the OHTs, including some like Rise. Leslie's there. I wouldn't be surprised that Mike is on here somewhere today. Welcome to Raham. It's been a while since, well, from time to time we get to see you, so it's really nice to have you join us here from Burlington. I wish to acknowledge that I'm speaking to you today from the University of Toronto, and for thousands of years, this has been the traditional land of the Huron-Wendat, Seneca, and the Mississaugas of the Credit. Continues to be home to many Indigenous peoples from across Turtle Island, and I'm grateful that I have the opportunity to work on this land and also to participate and support work from all of you from this point. Couple more. Great River far up in the north. So, oh, actually, no, Great River is not that's Rainy River. Great River is down here in Southern Ontario. Welcome, Ferdinand or Fernand. I'd like to know if you have joined us for a webinar previously. So if we could pop up this poll, or you could let us know this is your first event. So Sylvia supporting us here today is going to be launching these polls. We also have Myron in support, and we have some fantastic speakers today. I'll introduce them in just a moment. So please let us know, click in and let us know whether you've joined us before or whether it's your first event. Getting up, I think everybody can answer this poll question. It is not into very sensitive information. Okay. I think that's people are 2, 3 more. And okay, Sylvia, how about we share out the results? Great, thanks. And so we can see 75%, 24% of you are joining us for the first time. That is fantastic. Welcome. We run these events every single month. We've been doing it since 2019. And so today we're going to be talking about our survey that we ran recently. Our topics vary widely from learning health systems to performance indicators to equity measures. Today, we are really, really fortunate. We're going to have a really great lunchtime and into the early afternoon. I'm going to try and host as best I can and run through some of our results too, but I'm also joined here today by one of our key team members, Vijay, who has been analyzing the survey results and will be talking us through some of those kind of core results. Also, we are very fortunate today to have representatives from 2 OHTs, from Burlington and also from Ottawa West 4 Rivers. And they're here to share the work that they've been doing that we are measuring through the contents of the Ontario Health Team Leadership Survey. So Kathy Peters, She's an experienced health system leader and a presenter who's passionate about driving integrated systems. She's an authentic leader for sure, and she successfully implemented cross-organizational and sectoral collaborations, integrations from governance, strategic levels to clinical models of care. Now she is the executive director for the Burlington, Ontario Health Team, where she's been leading healthcare organizations to incorporate as a new not-for-profit organization with the shared purpose of promoting health and well-being for the benefit of the entire population. So that's been, we're going to hear more from Kathy about some of her key roles and some of the activities there. She's really focused on being caregiver and ensuring that the structures are built in partnership with caregivers and improving that experience. We have also from Ottawa West, both Nadia Prescott and Lee Couture. Lee is passionate about community benefit. She is the executive director of the Western Ottawa Community Resource Center, which is a multi-service organization providing accessible programs across the social determinants of health, serving communities of West Ottawa. And Lee has an extensive experience in collaborations and focus in equity work. In fact, she led the OHT's Equity, Diversity, Inclusion, and Anti-Racism Committee, fostering connections with residents. She is currently the co-chair of the Collaboration Leadership Committee of the Ottawa West Four Rivers OHT and has been a member of that leadership group since 2021. And finally, Nadia Prescott is a seasoned healthcare leader with experience in health management, strat planning, and program development across Ontario's health system. In her most recent role as the executive transformation lead of Ottawa West Four Rivers, she's passionate about the implementation of the OHT initiatives that align community priorities with provincial healthcare priorities. So that's a really interesting phrase, aligning. So I think Nadia will talk about some of her experience in that, and I will probe her maybe on the tensions in doing that. She also leads the governance structure, development and facilitating decision-making at the executive and board levels, and she really focuses on relationship-based engagement with the health system partners as a core approach for the Ontario Health Team. I think we're going to have a great discussion with these leaders as we learn from OHTs across the province and some of the leading OHTs, how they're doing things, ways that they are working, and hopefully with some opportunities for others in the province to think about some of those. Okay, we're going to talk today about the Health System Performance Network Organizing for Ontario Health Teams Leadership Survey. And I want to know what you know about the survey, not in depth, but just this little bit of, did you participate in the survey? Were you aware? Or, hey, you just came for the lunch hour chat and you didn't know what you were going to hear. Please let us know. Some people I know sign up on the regular, and that's like they know they're going to be learning something, and they may or may not have participated. So let's hear now of the people. We're up over 100 people who have joined us now. So welcome to everybody. And do feel free. I know some people have joined us more recently to pop your name in the chat. We're still watching for that. And it's still very useful for you to share who you are and where you're from as soon as you've clicked on this poll to let us know about your experience. I think we are slowing on the responses, so perhaps we could share back these results. We have about 70% of the people have participated in the survey at this point in time. So if you could just, oh, there we are. Now we're sharing. Thank you. That happened very smoothly on my screen. So we have 13% of our participants today participated in the survey. So you're going to see your results. We are also sharing them back to the teams and doing regional presentations. This is our provincial. So 60% of the people were aware of the survey. And so you probably know why you're here. And then for a quarter of you, this is going to be news to you. And it's good to know for us because we'll ensure that we do a tiny bit of discussion about what the content of the survey is. Okay, so without further ado, I'm going to now start talking about the survey, and then we're going to share out some of the results. And I am very encouraging of people to use the chat to drop in reflections, questions, comments. We'll stop kind of periodically along the way to answer and address some of these. But even just your thoughts or things that resonate or chance or opportunities that you think are presented for your OHT or for the province as you see these results. Don't be shy. We try to keep this an open and a conversation and create a safe space for challenging thoughts throughout. This is the fourth time we've launched the leadership survey for Ontario Health Teams. And this year it was launched between February and April. And the purpose here is for us to think about the capabilities that are within the leadership groups of the Ontario Health Teams to deliver on the province promise of OHTs. And that we can then use to help guide what supports might be needed to create a strong backbone for the OHTs as you and they work towards advancing population health. So our purpose is first to describe the state of governance, leadership, elements of organizational supports as they pertain to data, cultivating partnerships and relationships, so both technical and adaptive elements. And these are all known to be prerequisites for high-performing organizational networks. And OHTs are organizational networks, individual organizations coming together with a shared purpose. And our goal here is to identify best practices, share knowledge, and build capability and capacity across OHTs. And we're not here to grade people. We're here to support people's learning. And this is a self-assessment process. Topics included in the survey are governance, overall effectiveness and promise. And then you can see we have shared purpose, responsibility, some elements around leadership and adaptive leadership, the organizational approach that OHTs are taking, the context in which you're doing that work, elements of communications, operational approach, and readiness for change. And we're going to go through almost all of these, not every single one today. Our provincial report will be out in a few weeks, and you'll be able to see it. The slides today will be shared with the content for all elements. But we're going to, in the interest of being able to dive in a little bit, we're going to skip past a few of the results today. Everything in this survey has been derived from evidence, mostly from healthcare management, but sometimes we stepped straight into the management literature and organizational behavior. But you can see that we did our research in creating this survey and in developing it over time. The population for this survey included all 58 OHTs. All were invited to participate. 55 OHTs were included. The survey itself was distributed to one most involved individual from each member organization or individual in every participating OHT. So we sent out several surveys to each OHT and to each individual that are the leaders of those member organizations. We also got some basic information about the characteristics from the team itself. We started this work in February of 2025. Well, we started collecting the names before then, but we launched the survey on March 3rd to 1,557 individuals, and then biweekly reminders were sent to non-respondents until the survey closed. We're following best practices in survey distribution, and I think it shows our results were, you'll see the response rate was 55% overall and an average of 63% across the OHTs. The lowest response rate from an OHT was 17%. That was in an OHT with very, very many surveys going out, over 100, to 90%, and that was in an OHT that had fewer respondents from their team being invited. So the average completion rate once they entered the survey was 96.5%. So once somebody entered the survey, they completed almost the entire survey. The survey was about 47 items long, and it was really only taking people about 15 minutes to get through it on average. These were who responded. So by far, the lead respondent was the chief executive officer, president, or executive director in their own host organization. Next to that, we had administrators and general managers or other senior management. We had 60 primary care, so primary care being represented in almost every OHT, patient and caregivers represented in almost every OHT, and then you can see some other roles, but really very senior leaders taking the time to answer this survey and provide their perspectives on how things are going. This is where people are coming from. So the largest number, primary care or community health, and then community support services. But then also from each OHT, we have participants from home care, acute hospitals, mostly also long-term care, and then other sectors across the health system. And so you see quite a range of participants, not all in every OHT for sure, but definitely the kind of core services in every OHT, and then others also participating. So that's who we distributed it to and who responded. And now I'm going to get into some of the information that we have learned from the responses to the OHTs. So first off here is the areas around collaborative governance. And we have this section of the survey to understand the ways that the organizational network, the interorganizational network, is organizing itself to make collective decisions around resource allocations, coordinating joint decisions, membership, projects, and it's really a key factor that influences the performance of the network. We define governance as those individuals who constitute the primary decision-making group regarding resources, priorities, and membership. We have some factual information about this governance, and then we also ask some perceptions. Within the survey, the items in this section were responded to only by people who self-identified as being part of that governance group. So 465 out of the 850 respondents overall answered these particular set of questions. The rest of the results you'll see today were for the full 800 respondents. First off is the size of the governance group. So how many members? So you see the smallest proportion, 9%, have between 5 and 9 members. And then we have 10 to 14 members, 17, quite a few in the 15 to 19. And then almost 40% have over 20 members, between 20 and 67 members in their leadership group. This is a substantial increase overall, many more in that larger number. The median number of members has moved from 15 to 17, so not massive in terms of the median, but we are seeing this upshift in the size of the groups. There has been an increase also in the turnover within the group. So in our first period of 2020 to 2022, you see it on the left side, it was like 74% of teams had between 0 and 10%, very low turnover. It was quite stable. Now in this, many more years in, there's been more turnover. I think some of that is natural, but we see that it's almost 66% are more than 10% turnover, and we see there 28% of OHTs have had more than 25%. So that 25 to 50 plus 9% having more than 50% turnover. If you have more than 50% turnover in your leadership group, it starts to create, I think, some challenges in consistency and in fact, just getting people up to speed on what the purpose is, what people have been working on, and it can be a bit disruptive. So we're keeping our eye on that a little bit. We looked at the membership representation. This has changed a little bit. So you see on the right side, it's gone from 53% that, middle section, it says now it's up to 74 chosen to represent specific health-related sectors. That was 53% in 2022, and now it's 74. So the increase has been really mostly in the space of adding in sector-based representation to the leadership groups. And so that's been, so now teams are largely made up of original signatories, and if they need to, then also sector-specific groups that they've added in. So then it becomes, well, if you have all these people around, how are decisions being made? Is it consensus-based, which I think most OHTs are starting as a premise, or are there a few people making most of the decisions? What is the influence in that decision making? So we see here that on the right side in 2025, currently, about 47% of people would say that some members carrying a bit more influence, and 45 saying that all members have an equal influence in decisions. So we've actually increased from 38 to 45 the respondents in the last 3 years who say that all members have an equal influence in decisions. And I think that's quite important for building trust and creating kind of a shared purpose to know that everybody's voice is being heard through that work. So we find that to be reassuring in the context of the expansion of the teams. It becomes very important that those additional voices. The last item I'm going to just reflect on here is one of the questions that we ask, and this kind of relates a little bit to trust and shared purpose, both kind of together, about whether people in the leadership group felt that other members of the leadership group were fully committed to the success of the OHT. And we see here that, it's like 71% of those respondents either agreed or strongly agreed that the other members were committed to the success of the group, but also that has the proportion that are strongly agreeing has reduced by a fair bit in the last 3 years. So they're not quite as super enthusiastic about the peers and the members. And I'll say that some of our work has shown that this is significantly different between the groups that have more than 17 members versus those that have less than 17 members, which is the median, that we see more strong agreement in the smaller groups and higher scores in this domain in the smaller groups. So as the group gets larger, it's more difficult for people to really know each other, I think, and have confidence that everybody is as engaged as they feel they are. So some of our considerations coming out of this, and I didn't show you all of the survey results. So as I say, we'll have a report coming out in a couple of weeks. But one is that they're large and growing. It becomes, making decisions in a large group takes time, particularly if you're trying to do it with a consensus. And if you try to do it a little bit more with a smaller group making decisions, then you really need strong elements of trust. That's what the literature would tell us. Representation is primarily by sector and organization, as opposed to some OHTs have told us they do have other things around skills-based leadership that they're trying to introduce, but by and large, that's not a dominant approach yet. The OHTs, I mentioned this with the larger groups, had that lower evaluation of a mutual commitment. And other results have shown us that we ask a question about whether members are more inclined to their OHT or more inclined to their own organization, prioritizing around decisions. And most of the respondents, the large majority, are saying I balance the two at this point in time. And so, that I think is your leadership groups that's one of the things about coming from the other organizations is they're balancing those different interests that they have, and for the most part are unable to be 100% committed to the OHT within the organizational leaders. We suggest, that OHT governments might be better configured with fewer representatives and a little bit more attention to skills and competency-based representation. That would be with the literature in the space of leadership and governance over the OHTs, and then using their time to build trust and use shared performance measures as being some of the things that they can do to increase transparency to all constituents and also increase the opportunities for input amongst all constituents coming into the groups. That's kind of like what the best practices would lead us to think about this. So I'd be interested if people have comments or thoughts, results around those points that you could drop them in the chat. But I want to introduce Vijay to lead us through some of the other content of the survey. Please let us know your thoughts as you reflect and you listen to these things about how you feel about your OHTs.
Thank you so much, Walter. Hi, everyone. My name is Vijay, and I'm going to be walking you through some of our main results. So these are the domains, the 9 domains that Walter just quickly touched on that we're going to be covering for the remaining of the presentation. And some of these are existing domains from our previous surveys, and then some of these are newer ones. For the 5 that are, we've used from previous surveys, you'll be able to see a little bit of trends over time. So we use radar charts to illustrate the mean performance of different OHT groupings across these 9 domains that I just listed. And it looks like a spider web style type diagram. And then the gray lines, they represent average levels. And points closer to the center, they indicate perhaps lower capacities of that OHT or grouping. And data points that are plotted further away from the center, they reflect stronger average performance relative to other OHTs or groupings. So this on your left is a spider diagram, which illustrates the mean scores for each category of lead organization. So whether your OHT is hospital-led or non-hospital-led, and geography, which is small community, rural, or the urban, suburban. And you can see here, hospital rural OHTs, so in the red, that's very close to the closest to the center, they tend to have lower capacities in all of these nine domains. And then non-hospital urban, which is the blue on the outer of the web, they generally have higher scores. This we found is slightly different from our previous results, where it showed that then non-hospital rural OHTs tended to have the highest scores. And then you can see here we also illustrate the 90th percentile in the green there, which is the most outer circle. So each question we asked was on a Likert scale from 1 to 5. And the bar graphs you're going to see in the next few slides, they show the average proportion of respondents which selected each option within that OHT. So the red and yellow is the more negative responses, and then we have the blue and green, which is the more positive responses. In the bar graphs, we also have purple and black dots that show the OHT specific mean scores. So purple is the 2022 results, which we have for 51 out of the 55 OHTs, and the black is the 2025 results. And we also have black and purple dashed lines, which indicate provincial averages for each domain. Sorry. This is just a written description of what I've just talked about. So diving right into our first domain, overall effectiveness and promise. This domain based on having strength and capacity and having the likelihood of achieving objectives. So it represents the closest approximation that we have as an outcome measure for this survey, if you will. And we're very happy to report this domain saw the most positive change from 2022 provincially. So leadership respondents, they've significantly increased their overall perception that one, people are likely to succeed, and two, that OHT objectives can actually be achieved. I did want to also point out Ottawa West Four Rivers. It was one of the most improved OHTs. You could see it's very small, but you could see at the top there, they've improved quite significantly. And then I also wanted to get a shout out to Elgin and Berrien area as well. And then this domain also saw substantial variation across the OHTs. Moving on to shared purpose. So, this is really about an organization having common goals and collective understanding of the work that they're doing together. So, we took the scale is based off of 3 items from Haggerty et al., which really captures how much these goals are truly shared. And we found that this domain saw a slight increase from previous years. So the mean score went from 3.65 to 3.71. We also saw substantial variation across OHTs in the degree of shared purpose. Our next domain is leadership, and it's about how leaders bring people together by building trust, aligning diverse partners, and really creating conditions for problem solving and innovation. And we measured this by looking at how well leaders are able to communicate the vision, address power imbalances, foster respect and trust, and openness to different perspectives. We found that leadership did not rate highly. The overall average score ranked 8th out of 9 domains capturing critical success factors. It had an average score of 3.42 in 2025. When we look at trends over time, the perceptions of leadership remain stable for the overall population of OHTs. You can see the mean score didn't change. It was 3.42 in 2022 and 3.42 in 2025. Although some OHTs you can see here with the purple and black dots, some improved and some declined, but provincially it was pretty stable. Moving on to our next domain, organizational context. So this is a new domain for this survey, and it's really about creating the right environment within the organizations to support things like collaboration and learning. And we look at this through 2 subdomains. So we have the performance management subdomain, which focuses on setting clear expectations, accountability, and discipline. And then we have our social context subdomain, which focuses on things like support, trust, and psychological safety. And together, these elements really help team work effectively and adapt to challenges that may arise. We found overall, this domain did have the lowest score, so it had a mean score of 3.11. We found that this domain consisted of 16 items. A lot of it focused on performance management and accountability arrangements that are still in development across many OHTs, which may be contributing to a little bit of the lower scores. These are just the list of 16 items that are comprised in the domain. And then our next domain is operational approach, which again is a new domain to the survey. And it's based on a learning health systems concept, which integrates research directly into care delivery rather than keeping it separate and as an afterthought. And it consists of 5 learning gears that represent different ways to use evidence and research in order to continue to drive learning and improvement. And overall, the OHTs scored moderately well in this domain. It had a mean score of 3.6. So this is just a spider diagram that I've shown before, and it's just diving a little bit deeper into the 5 specific learning gears of the learning health system. And what we found was that OHTs scored the strongest in actively engaging with diverse partners, and they scored the lowest in using evaluation processes with ongoing data and frequent cycles of reporting. We also found that there's a high proportion of OHTs identified using external evidence to select and guide initiatives. The last domain that I'm going to, dive a little bit deeper into is readiness for change. It's about whether people believe the change is needed and worth the effort. So, as we know in healthcare, it's very essential for gaining that support. And we measured this by looking at whether OHT initiatives is seen as providing real value to individuals and their organizations. And readiness for change had relatively little change overall and for individual OHTs since 2022. You could see the mean score was 3.49 in 2022 and 3.48 in 2025. However, as Walter mentioned, we've done this survey multiple times, and the original time we had distributed this survey, this domain was one of the highest rated domains in that survey in 2020, and it took a pretty steep decline of 1.6 points in 2022. And we found that although it's stable from our previous iteration of the survey, it hasn't really gone up back to that initial high. And then there's 3 other domains that I just wanted to quickly touch on just for the interest of time and having more time for discussion. So we have shared, there's 2 domains which were relatively stable and had slightly lower variabilities across OHT, which was shared responsibility with a mean score of 3.74 and communication with a mean score of 3.6. One of the things I did want to point out was overall, we found across all the 9 domains, there was a trend of lower scores on most domains for later cohorts, although we didn't find that this was significant. And this was true for all domains except for this communications and management domain, where we found cohort 3 plus had higher scores than cohort 1 and 2. Again, none of these differences were statistically significant. But another thing I wanted to point out was we also looked at I-12 teams versus the rest of the OHTs. And the I-12 teams, they did have statistically significantly higher scores compared to the rest of the teams on most domains. And again, you'll be able to see more details on that in our provincial report that's coming out in a few weeks. The final domain that I wanted to point out to is a new skill. It's related to organizational approach of ambidexterity, which is basically the organization's ability to have both a growth and a production orientation. And what we found was OHTs tended to do well on both of these capacities or less well on both of these capacities. And this domain was actually one of our highest rated domain with an average of 3.85 out of 5. And just wanted to highlight a few notes here. So we have overall effectiveness in province, which with the mean score of 3.7, which is one of the highest rated domains. And it was our one domain that showed a statistically significant increase from our prior survey in 2022. And then we have 2 other domains with highest degree of capability was organizational approach and shared purpose. And then three domains with lower capability include organizational context, which had our lowest mean score of 3.11, and readiness for change. What we found for readiness for change was it had relatively low variability across these OHTs, which indicate that improvements could be best achieved through maybe system-wide improvements. And lastly, leadership, a mean score of 3.42. We found with leadership, there was a lot more variability between the OHT mean scores, suggesting opportunities for maybe some cross learning. Our survey did have a number of important limitations. So first, it was self-reported data, and that comes with its own set of limitations. The survey was also voluntary, and as so much as we do to ensure, many people are being represented, there's not much we can say about the non-respondents. And lastly, we found that some respondents who provided highly patterned responses. There are also a number of important strengths with our survey. The population and sampling approach followed rigorous survey protocols. We had a really good response rate of 63% across OHTs. And then, as Walter was mentioning, our majority of people that started the survey completed the survey. It was near complete. And lastly, the size of respondent population provides support for our validity and representativeness of the overall survey results. And then also just wanted to end off my presentation by highlighting a few OHTs who have ranked consistently over the 80th percentile for all 9 domains. So we have Burlington, Ottawa, West Four Rivers, South Georgian Bay, and Couchiching. Again, they ranked over 80th percentile in all domains and had an average percentile of greater than 93%. So big congratulations to you. And I'm going to end off there. I believe we're going to hear from Burlington and Ottawa West Four Rivers, so I'm excited about that.
Thanks so much, VJ. And if folks have some questions or comments about about some of the results that you're seeing here, please pop them in the chat. Just very interested in people's reflections today. And so I'd invite now, we do have leaders from Burlington and Ottawa West Four Rivers. If you could put your videos on and bring your mics on, and maybe we can bring down the slides and just have a little conversation around these results. And also hats off to some of the other teams. I think for people who have been following us for a little while, you've seen South Georgian Bay on our webinars from time to time. As they've been in, particularly around their work in engaging with their patients and their patient experience teams and using surveys population-wide to drive their work. And also Couchiching was one of our developmental evaluation teams in their early days. And also have had there. So I don't know nearly as much about Ottawa West Four Rivers and Burlington, and so it's a real opportunity for me to learn here too, as well as for all of us here to learn from what these teams and if you take a look through the charts, they're at the top very often and have made substantial improvements since the last wave of surveys. It's really, really quite remarkable. So welcome. I gave a little bit of an intro to each of you before, so I'm really happy to have you here. And why I think I'll just kind of like put out a question, and then maybe both teams can respond, and then we'll kind of go on to a couple. We just have a few here that we might speak to. So first off is did you share these results with anybody else? I mean, we sent them out to all the teams, and then we're like, I don't know. Hopefully they use it. Hopefully we can think about that. And then if you did, then how did that discussion go? Maybe I'll ask Ottawa first.
Sure. Thanks, Walter, and glad to be here today. Yes, we did share these results with our leadership team to start, so including our OHT and our PCN co-chairs. And of course, our implementation team. The timing just happened to work out really well. We received these, I think, around the end of August, and we were meeting to look at our operating plan and really refine that as we moved into September. So it really was actually lovely to take some time in that little small group discussion to reflect on the value of our time spent as OHT backbone team members and leaders in some of these areas around governance, because our operating plans tend to focus so much on how can we make impact in community, and really helped us think about the importance of this work in building our partnerships together as well. Our leadership team really holds me to account in formulating agendas for our monthly meetings that allow for really good generative discussion and not just the many info and updates from the OHT team. So we did share this as well with our full leadership team, who was part of the survey response. And we really wanted to take some time to celebrate that success that we saw in the improvement from where we started in 2022 until now. And then also to, you know, I would be remiss to say our OHG team and our leadership group looked at it and said, hey, why don't we set a goal for us to increase our response rate in the next round, and perhaps think about improving the communication around the process, what the survey is, why they should complete it when they're receiving it directly from HSPN. So not without looking to improve upon our results. And then we encouraged our leadership team, obviously, to come today to the meeting, to the webinar, to hear more about the survey specifically from the group from HSPN and from others in the province as well. And I think I'll hand it over to.
I don't know if you have anything to add. Otherwise, I'll ask Kathy if, you know, from Burlington, have you used the results at all? And how did that go?
Yes, thanks for inviting us, Walter. Funny enough, took a huge leap of faith, and we, as a quality and performance standing committee of our board, we are a not-for-profit OHT incorporated, and we took a bit of a leap of faith, and our board decided to use the HSPN survey in early April as one tool to measure the performance of ourselves in the governance and as a not-for-profit organization. Not knowing the results, but knowing that our board had just recently completed it. And so I was happy when we did well. But they saw the value in this. And I know we're going to talk about why we see the value in the next question. So that was a bit of a leap of faith after they had completed the survey. Our board chair, you know, strongly believes that this is a relevant measure of performance for OHTs, and in particular for us to use as a benchmark. I also shared it with our staff, and you know, they felt, I think, proud and felt in some ways rewarded for their efforts. And although not all of our backbone staff are really close to, for instance, our board work, but we've always been conscientious to bring governance into everything we do. And of course, collaborative decision making happens not just at the board, but within all our committees, working groups, and councils. And so everyone on our team feels like they are contributing to those 9 domains. And so I think they felt that you know, some pride with the results. Also recognizing, to Nadia's point, that it continues to be a continuous improvement effort. This is something that you just don't stop doing. You need to work to maintain those relationships, because we are in the business of relationships. And when you have turnover, as you discussed earlier, it's even more important to ensure that everyone is up to speed on the shared vision and mission and purpose. So we will be sharing and doing a deep dive at our next, we meet quarterly as a board. We've moved, you know, we've been doing this for 6 years. So we used to meet every 2 weeks, and over time, as we've evolved, now our board meets quarterly. And so we will be doing a deep dive of the results at our upcoming quarterly meeting.
Great, thanks. And so I guess that's, you know, to the illusion of, you know, how you're going to use the results. I think you've already talked a little bit about that, but, you know, maybe just an extra little bit of, you know, Kathy, like how it is useful to your team to have this information versus not having this information, right? Like, I'm going to, maybe we'll get some time after to kind of talk a little bit about many of the elements, and you alluded there, are relevant not only at the senior leadership, but they actually have relevance within teams that are implementing. And some of the tools that we actually use are like, this partnership collaboration, which is a little bit more about leadership, but there are things around what we're actually doing in the work, like particularly elements of the learning health system, using data, developing co-design workshops. That work happens more at the front line. So I think I'd be interested down level in your organization, your implementation team, and maybe even the subgroups that are doing kind of implementation work. And maybe I'll put out a poll to other people online if they think that would be useful, and we can figure out the logistics of doing it, which is probably not quite as straightforward. But anyway, so Kathy, but just how is this survey useful to your team? And then I'll come back to Ottawa.
Yeah, I think the information provides, tangible results on performance measures that we don't currently track. So, probably like most OHTs, we've been very focused on sort of those public facing services and how do you measure, those integrated care models. We also have measures that are, directed to us. And so I personally have not spent a good amount of time creating measures to reflect, the governance, the, shared accountability, responsibility, and the measures that this survey looks at. And so I think it only makes sense because the core business of Ontario health teams is in fact that. Many of the measures we're asked to be measuring, we actually don't have direct impact on. And we often say this, like, well, this is actually measures that our providers are influencing at the system level. And so the core functions of an OHT is really about building strong governance models, collaborative decision-making structures, creating safe spaces that are diverse and inclusive and representative of the communities that we serve. And all of those pieces around collaborative planning, collaborative accountability, collaborative reporting, and the infrastructure and environment that you have to create to be able to do those things as an OHT is actually more reflected in the survey that HSPN has created than in the impact measures we're being asked to report on.
Oh, wow.
Kathy's opinion.
I'll take some credit for that. Thank you. That's good to hear. I mean, we are trying to be, reflective. So that's particularly, good to hear in this area. We do lots of other performance measurement too. And we do have indicators. We do have other things. But we think that this is kind of core business to what OHTs are doing. And as I say, we spent some time in the scientific literature as well, that we had both relevant measures from your perspective, but also robust measures from scientific. So hopefully we I don't know, Lee, Nadia, what about from your perspective? Like, how's it useful, or how do you see the uses?
Maybe I'll jump in and then Nadia can jump in too. I think for us, it was an opportunity to pause and reflect and recognize areas that we're working and areas that we improved on since the last survey. We took some time to compare our own benchmarks against ourselves. And a couple of the areas that we focused on that resonated within our leadership group were some of the relationships between service providers of different sizes, types, focus areas, and an invitation for how we work together, and really wanting to make sure that things that are effective, we saw really good results in communication. And that's an area that we want to be really intentional about as we look forward to different activities across our OHT, and not lose sight of things and areas that are working. Talked a little bit about change, and we're seeing some change happen within and across our OHT as well. And so really wanting to maintain some of the gains that we've made since the last survey. And so we took some time to be really intentional and focus on some of those areas. Want to jump in, Nadia?
I will only quickly add the other thing we reflected on is how, and perhaps Kathy, we can learn from you, is how to, we recognize that this is a reflection of our leadership team who is most engaged in the work across the OHT, and how can we understand how our broader partnership experience is reflective or not reflective of that same in these areas. So we are going to, at our next meeting, talk a bit more in depth about how we might use a tool or a modified tool like this to better understand our full partnerships experience across some of these areas.
Yeah, thank you both. And you've also all highlighted the value of reflection. And I think that I'm really happy to hear you say that, and I hope OHTs across the province are taking the opportunity to look at the results and take a moment, because there are a lot of updates, right? There's like, what are we doing for primary care attachment? What are we doing for our integrated care pathways? What are we doing for, many of the reports that we need to produce, and this kind of work, really requires some time to self-reflect, and it is an ongoing process to do that, right? And so I'm heartened that it's been useful. I think both your teams have advanced over the past 2 years in many of the elements. I mean, and I'll say, neither of you are at the top of every single item, right? But you've definitely advanced quite a bit over the last 2 years. And I just wonder, any ideas around, specific areas, and I might pick on leadership as being one of the areas. And if you look at the leadership domains, it's an area both of you have improved and are doing well. And it's around creating safe spaces, and it's around improvements. And there's a fair bit of variability across OHTs. So one of our recommendations is there's some things that all OHTs are going to need support, across the board, because there's not a lot of variation, and to move people, we probably need to help everybody. But some of them, there's more variability, and there's some things that you're doing that I think maybe others are not doing as much. And so maybe just some of those things you've done over where you've put your emphasis in the last couple of years. Maybe I'll start with Ottawa again on this one.
Sure. I can start, and happy to have Lee add to if she has. Again, I think most telling for us, we don't know always what others are doing, though we try to join as many webinars and peer sharing opportunities as we can. But again, was reflecting on how we compared to ourselves from 2022 until 2025. So for some context setting here, I think we were somewhat lucky in this regard, because Ottawa West Four Rivers was, as a cohort 3, just getting established in 2022 when this first leadership survey came out. And as a cohort 3, we were likely, that in some way likely contributed to some of the increases that we've seen over this time. So I think it is important. I think I saw in the chat some questions around this too, and reflecting the maturity level of OHTs as part of this survey is perhaps useful as well. Our leadership also reflected on our OHT's approach to partnership and the inclusion of different voices and perspectives, regardless of the sector. So the OHT had really established itself, being really mindful of who do we want around this leadership table, and what different skills, expertise, as well as geographies are they going to be representing. Our journey as an OHT, this was before my time, but was one of 2 applications that were asked to combine and come together to form this OHT. In 2021, and then we'll get started in 2022. So we had just had that process, and this was discussed at our leadership committee meeting when we reviewed these results. And it was interesting to hear a reflection from one of our key leaders from that time, who led one of those first proposals, and some of the reservations that they had at that time, worrying that their voice or their perspective of some of our smaller or more rural communities may be lost as they came together. And they really reflected on the strong leadership, the co-chairs of our OHT over the last number of years, who have really made sure that we maintain an equal voice across that leadership table, and that we're open to the perspectives in a truly fair and equitable way, including those of our lived experience partners at that table as well. So we really do, I think, always take time at knowing the nuances and the history of the OHT, and this can change over time if our leadership table changes, but it's going to be really important to keep people mindful of that nuance in our OHT, where we have urban communities in Ottawa, suburban communities to the west of Ottawa, and some smaller town and rural communities also, and not to lose those differences as we think about the work that we undertake, and we balance the work across the different communities within our OHT. I will also just briefly say, and I, will maybe ask Lee to speak into this later if she feels that our leadership team also just reflected on like the implementation of a backbone team and the work that our team has done to contribute to the success. Kathy touched on this a little bit earlier as well. I think, in 2022, where there was likely maybe one OHT staff at that time that the survey was done, to now having a complement of a team over the last number of years who are able to support our partners in coming together to collaboratively and to collaborate on projects and initiatives and to support them in the ways that we can as an OHT implementation team to move their work forward. And so I think that's also a piece I just wanted to reflect on is really our journey over the last 3 years. Might look different than some other OHTs clearly across the province.
Do you want to add to that, Lee? Or yeah.
I would just add that I think the backbone team has been really crucial in supporting the convening opportunity from across organizations. So they really have a good sense of what's happening across the whole OHT and have championed and taken opportunities to bring partners together when there's opportunities to work together or collaborate that maybe aren't naturally happening, and doing that in a really active way invites opportunities to collaborate where partners might not have come together or have competing interests. And so they've really played a crucial role, I think, on creating space for that active approach to collaborating. And in some cases we're working in environments where we might be organizations might be competing for the same resources or have very different perspectives and different kind of work and priorities within our own organizational contexts. And our team has been really great in terms of cross-pollinating learnings between different groups, between our different action teams, across councils, and helping to disseminate that knowledge across all partners. I think that's been a big win across our team for sure.
Yeah, thanks very much, both of you. But certainly some intentionality there. I don't know, Kathy, how about you over in Burlington last couple of years?
Yeah, over the period between the last survey and this survey, we underwent incorporation. And although I believe for our group, our needs to serve our attributed population of about 230,000 people, that is the right governance model and structure for us. I can only speak to what is working for us. But I think the planning in that and developing the governance model is really where we advanced, and we were able to find that commitment to a shared values, really solidifying our purpose, because you have to write it in your bylaws, and shared accountability for our attributed population. I think that was really where the leaders came together and said, yeah, we are in this truly together. And now we are saying, through legal documents that we're in this together. We've also focused a lot on our board leadership, and so the board members are very mission aligned. That helps to maintain the focus over the long term. In the OHT world, as we all know, you can get distracted by a lot of pivots and turns along the way. But if you have a committed leadership group that see the long-term vision and can maintain that vision while also getting some smaller wins or pivoting where needed, that can lend to a really strong, effective group in collaborative, integrated care. I'd also say, we dedicate time, and maybe this is by nature of now being a corporation, but to strategic planning. And so people feel like they're contributing and seeing and helping shape that vision. So then they feel more accountable to it. I think you spoke a bit about this when you showed who completed the survey, but we do have a skill-based board, but they're the highest level decision maker because it is a member-based board. And so having those very senior leaders committed ensures compliance among the members as well, which I think has helped us to advance. there's so much to say in this space, and some of it is a bit speculation, to be quite frank. But there was a big fear as the ED and across our board that we may lose our way after a change in designation not being a focus for the Ministry of Health, because we actually believed incorporation was the right thing for us to do and made that decision before the possibility of designation came forward with the path forward document and the guidance to incorporate. But by having that path forward document validate that we made the right decision around incorporation, we really felt bolstered by that. And so there was a real risk when we, in the last year, have stepped away from a focus on designation. And so I would say going back to that like long-term vision and not getting distracted by the pivots and change is really important, and can only come with building those relationships at the member level and leadership level, and building trust that everybody is still in it and you're doing it for the right reasons that are both locally driven and supporting provincial priorities. I think there's no handbook on how to do this, and everybody's in a different space, but I think all of those elements around planning for governance, planning for incorporation, and getting people together intentionally over a 2-year period to really dive deep into that governance helped us survive the bumps along the way.
Wow. Thank you very much, Kathy. And I think there are some comments from people in the chat also thanking all of you for some of the insights and suggestions. I do wonder, I've asked you to mostly talk about your own OHTs, and here's my surprise question. You didn't know about it. Well, I just actually got it from the audience kind of thing. Actually, Angela Freeman here, around, thoughts towards other OHTs, particularly, if you were to look in yourselves, like, I can't remember exactly where you were, but I know that both of you have improved a lot. So both of you were further down the ranks last time, that's for sure. And if you were thinking and you're talking to someone who's like a little bit further down, and I think we've already talked a little bit about the validity of probably what we're measuring here. So if we assume that, we have a reasonable, I'm not going to say we have a thermometer and a, mercury and a thermometer, but we have some indication here. And if you were, talking with one of your colleagues that was, a little further down and maybe not quite the results that they were hoping they would get, I don't know if you have any thoughts about where you think you might guide them over the next, year or so, sort of like medium term, about what they might do. So let me put that last question to you. We could have a long conversation. We have a whole question on what else we should be measuring value, but I'm not going to get to that. I'm just going to ask this as you're speaking to your colleagues out there today who are, participating. How about Ottawa first?
Can I jump in there, Nadia? Is that okay? Yeah. So I would one of the best parts about our OHT, I think, is that we lean into the collaboration part of our collaborative decision-making processes. And, our organization is a bit of an atypical partner. We're a community support services provider. We are a multi-service organization. And sometimes we come at solutioning from a non-traditional health perspective. And we work with some really strong-willed, incredible lived experience partners in our collaborative leadership group, who hold us accountable for doing what it is we say we're going to do, and being open to leaning in, having hard conversations, and really creating an opportunity for multiple voices and perspectives and a diverse group of folks to be heard when we're making decisions and coming together and planning. And I think one of the greatest impacts that we've been able to have when we're moving initiatives forward has been on not limiting ourselves to the status quo or our current state today, or working within that as a limit, but really working with a group of folks who are quite visionary, who have ideas about what the way forward and future should look like, who are invested and willing to invest in moving progress and the needle towards some of those things, and creating space to welcome some out there ideas sometimes for how we might be able to move something forward, and inviting a lot of voices into working collaboratively with the OHT So I do find that the folks who are the backbone supports, Nadia and her team, are really, really good at, when we sort of move to an adversarial place where there's competing interests, at trying to rework our leadership folk to explore ways that we might collaborate and intentionally bring that forward and say, okay, is there a way that we can invite some sort of collaborative approach? How else can we look at moving this forward? I think we're having some of these conversations now, and making sure that we're holding ourselves accountable to that collaborative way of working has fostered an incredible amount of trust within our OHT, cross-organizational trust, and that's benefited both the OHT and the initiatives that we have as a collective. And in my experience, it's also benefited our own organizations. And so we've seen sort of other initiatives pop up from relationships that were built through collaborations within the OHT that benefit our community. And ultimately, that is why we're all here. And that feels really clear and strong in our group.
Oh, thanks. Nadia, any thoughts towards others? Thank you, Lee, very much. I think those are very insightful, and also from a different perspective too. So
I will just quickly add, because I'm sure Kathy has something some great nuggets for us too. I think I reflect on the first trainings that we did as an OHT when we came together, and there was I'm going to get this, I should have thought about this before, but there was different domains that we rated ourselves in as part of this session. And there was probably maybe like 6 or so of our leadership team that were part of that original session, I think through HSPN and I think Ross Baker and others. We used that at our leadership table and actually had open conversations around how can we all now rate ourselves across these and identify those areas that we see that we've rated ourselves low, and what does that mean, and what do we want to focus on? What are the 1 or 2 things that we want to advance on? And so, did we stick to that, as a regular review? We did it a couple of times, but I think that, using this leadership survey perhaps in that way to you can't fix everything all at once, and nor should we try, but is there one that the leadership agrees on is important to dig into a little bit more and do some intentional work around, or have some conversations and have that conversation together with one another. Sometimes when we do poorly on things, we think, oh, I'll go into a room and I will figure out how to fix this and come up with this great plan that I'll present back to a group. I think the OHT model affords us this opportunity to not have to take any of this on alone, but to rather do it together. And so just think about maybe identifying a couple of those areas and really understanding why those reflections came in the way they did.
Yeah, thanks.
It wasn't the same survey. I'll try to find what it was and put it in the chat.
Thank you. Yeah, and so Kathy, how about you? Thoughts?
Yeah, I think OHTs are tasked with something that isn't, for the light of heart, which is to integrate a system that is built to be fragmented and siloed from, funding and how decisions are made and how sectors are sorted, and, to do integrated care well, we're talking about the intersections of health and social services and housing and et cetera, et cetera. So, give yourself some grace if you didn't do so great on the survey off the top. I think perhaps OHTs might want to reflect on some of the, what might be standing in the way of bringing your member organizations together in a real way, in which, Lee and Nadia have done a great job of describing. I think it has a little bit often to do with some of that power dynamics and ensuring people have equal influence. And I think we all know the basics around that, be very transparent, over communicate, because if some people have information and others don't, then you're building power imbalances within your OHT. And ensure everybody has equal voting rights. All of that is, I think, very specific in what we're all doing. But, you might even need to go a little bit deeper in your reflection. I'm always thinking about optics of things. And so, yes, I'm at a benefit in our OHT because we are incorporated, but making sure there is a nice arm's length between the OHT structure and backbone and your TPA holder is really crucial, to not lean into those optics of, your TPA is running the show. And so that might be everything from like how you communicate and what your email domain is to where your staff work and where their offices are located and where you hold committee meetings in person. And like all of these really like tangible things make a difference if you're not conscientious. Like you have to be overly conscientious when you're working in the OHT world and be overly sensitive to how things are perceived. And so if any, these are just very operational things, but I think if you're not thinking all the way through from board governance to like where you hold your meeting or what your email looks like, you might be missing some real opportunities to start breaking down those divides and really give your members not only the perception, but the knowledge that everyone is equal. The backbone team is there for all member organizations. We have meetings in all our member organizations buildings. Like we're very intentional about people realizing that we are not just there for the hospital or not just there for primary care, but we're there for the entire integrated care system. So, I have to say, what the evidence shows about the smaller governance is like probably something you should be looking at. We have a small board compared to many. And, legal tell you anything between 10 and 15 is like the sweet spot for decision making. If you're trying to lead at a decision making table of like 20 plus, like I give you all of that power and hope that you can do that, because it's tough when you get into those big numbers. And as Walter said, the research shows. So having a tight membership that are there for a real purpose. Because if someone is there and they don't know what's going on, they also feel like they don't have an equal voice because they can't contribute. So making sure form follows function. What are you trying to do as an OHT? What priority populations? What models are you focusing on? And have the right players at the table, and then just communicate very transparently with the larger group. And maybe these are tips that would work. I don't know, Walter. Who's an expert at this? I don't know. Thank you, though, for letting me give some tips.
Very much. Globally, there is not a gold standard in this where nobody has actually really completely globally nailed this. And I do a lot of work internationally in the International Foundation for Integrated Care Canada. And I encourage people here to follow that in the North American Center for Integrated Care, because there's lots of work in that space that helps to support this action. I just want to thank the three of you so much for taking the time to review, but also be willing to kind of come up. And it's not always easy to stand in front of your peers and say these things. And certainly really appreciate for everybody out there participating today, and those who might lots of people will watch this after as well. Give yourself some grace to everybody, all of the teams out there, I think, for doing this work. And it is not easy work. It is the most difficult space. And I've learned a lot about the backbone teams and some of the work that you're, very intentionally doing about inclusiveness, and having shared accountability. There's lots of lessons to be learned here. There are there's one question in particular raised by Patrick around, issues that might be emerging related to leadership with the new priorities around primary care, and this is like a new priority being pushed province-wide. I am not going to ask that of you right now, but if you had the time, you could look in the chat if there's something small you could put in there. There's one or two more things we want to kind of cover off before we close. I just want to really thank you so much for taking the time and your insights today. And I hope you all know that this will be widely available on the web for people afterwards, our conversation today. So people will continue to be able to learn from your insights. And I'd love to chat for the rest of the afternoon entirely, but we're going to close it off now. Thanks again, Kathy, Lee, Nadia, for this little part. And so for all of our listeners and participants today, we're going to go back to just a few more findings, actually, we had in the survey. And one of the things, we had all those kind of standardized questions, but then we also had this open-ended space that said, is there anything you'd like to add that wasn't covered? So we've done a little bit of content analysis around these, not so very sophisticated. We haven't had them very long, and for those who know qualitative research, it will take longer. But there were over 260 odd individuals who wrote time to write comments, and some of them were one sentence, but many of them were like several sentences around their insights. So I just want to share a couple of those themes with you. So first off is 5 preliminary themes. There was one around power asymmetries, and I think you've seen, probably heard about some of these also in the content survey, but we'll get a little bit different here. Capacities, resource, and competing priorities within the membership. System direction and mandate from the Ministry of Health and Ontario Health, and somebody had mentioned an alignment between their own OHT and the ministry and OH priorities. Some people find that, some people find it difficult. And primary care advancement and implementation challenges. So here are just some quotes. That's all I'm going to do here is drop out some quotes so that you can see what people are saying outside of those standardized elements. Sometimes be challenging with hospitals and the power they come to the table with, and the overall model helps with this, but it remains a challenge that some people find very difficult to manage. And there were a number of comments that talked about the hospital focus of OH and the ministry. Some people feel that out in the system. On the other hand, we also have people that are saying we have a planning table made up of all organizations and patient family members who make all of the decisions using a consensus model. So finding that way of moving forward is and this is somebody who I imply would be speaking from a pretty egalitarian approach across those. Around capacity, with no continued investment in capacity, we'll make progress, but not enough. And noting that a lot of the quality improvement resources and capacity building in the system are gone. Mike and Leslie and the whole RISE team will say, no, not all the resources are not gone. We still have some resources, but that is, a relatively small team to manage, a system change for, we're probably up to 60-something billion dollars in the health sector system now and 58 OHTs. So people are struggling to pull all the resources in to be able to do this well. And there were many people with those kinds of comments. Also this, alignment of what the different groups are doing. So here, the OHT leadership team and the board know what's needed in our community or in the community to improve health outcomes. And it's hindered by the lack of ministry's full commitment to a fully mature state, and also hindered by small bits of one-time funding that carry lots of paperwork and admin burden. These available funding streams are not always aligned with what we would prioritize locally. A number of people talking about this kind of gaps in the alignment. In terms of primary care advancement, engagement's been spotty. It's been unclear what the goals are or how my team and the population can benefit. So we had the survey items around readiness for change, and those items were around the perceived value of the OHT. And so I think from a primary care perspective, people have had some challenge in seeing how the value add. And recent work focused on building primary care teams and primary care networks, that's what PCN stands for, is adding value. So people feeling more promising in this primary care space as a result of that primary care focus. That might speak a little to Patrick Fang's question. And then another comment here about important to engage the docs first. And without that engagement, we can't move the OHT forward. So being really essential, and so perhaps that's actually being a positive thing. And lastly here, I think the OHTs have a challenging task, and that getting buy-in from all signatories is there in theory, but the implementation is quite the challenge. And I think this is where we get skeptical. And the low rules and disorganized environment that was largely unsuccessful during the implementation of Health Links remains unsuccessful with OHTs. So being a perception that we haven't actually built a lot of the infrastructure, although I think we've heard today from Burlington and Ottawa West that obviously there are teams that are out there that are figuring out how to create, approaches within their OHT that are lending themselves to success, even without having some sort of single standardized model that everyone is being asked to or told to implement. So I think we still have a little bit of a balance and perhaps even a lingering tension around that. But as OHTs move more from planning to implementation and delivery of those integrated models. This is going to continue, I think, to be a bit of a tension, and we're going to need a lot of support to the teams in doing that work. So just some of the comments. We're going to have a report a little bit later this autumn as we have a little bit more time with that qualitative data, because it's, you know, several pages and pages and pages of text to distill out some of the summary findings. One of the other things that we have, last thing, this OHT specific comments. These are about people talking about their own teams. And I'll say, you know, kudos to the teams out there. You know, people who have responded to the survey saying they're very impressed with the leadership at the OHT at all levels. The team represents the Ontario Health team well, and the staff show up positive and engaged. So kudos to all of the backbone teams that are being commended there. And I feel our local system continues to benefit greatly from the leadership of our OHT. And the key in this next phase is stronger levers of integration and a clear directive for the path forward. So I think that's to some of the comments I was just putting in. And I'll invite everyone here today to think about your own chat, the topics. Some people have been putting some comments in, but welcome you to add your own thoughts on your experience. But you're going to have one more point of audience participation back. And it is because I have 3 elements here, and we're only going to have time to do one. We have done a review of our use of performance measurement across the OHTs and done a number of interviews across 6 teams about, you know, how you use data, how you could do it better, and what we can do to better support you. And one thing that has really come out is being really clear about the explanation of the data, how you use it. I think we've done some of that today. But then also, if it points to some areas for improvement, what to do next. And this hasn't traditionally been in our area, where, you know, our area of expertise is mostly around performance measurement. But I say to my team, if we're still doing the same thing a year from now, we haven't learned anything. And we are a learning organization, as I hope you are too. So we are looking to have some research that follows up to say, what are some evidence-informed actions? So I picked out 3 today, given the results. They're all areas that are highlighted in the report that could use some improvement. So the 3 areas are shared purpose, performance management, and adaptive leadership that all came out with opportunities for improvement across OHTs. So I'm just going to ask Sylvia if you can bring up a poll to ask which of these 3 topics in the last kind of 4 minutes would you like me to just refer a few kind of key findings about. So here we go, and we're going to keep this down to, you have to go quickly to answer this question because we're going to move on pretty quickly. So please jump in there and say which of these you would like us to focus on. And give it 10 more seconds. 6, 5. Okay, why don't we share the results? And the results are that you would like to see a little bit more about performance management. So I will go to that one. And this, we are going to be putting out a report probably later in the fall again. And we're just starting this. This is a new area for us. So we're going to go to the performance management and these slides. So you'll still have this content available to you. So first off, 2 references that I recommend you have a look at. Measurement of Integrated Care Delivery, System of Methods for Future Directions. That's in the International Journal of Integrated Care. Both of these are in the International Journal of Integrated Care. Second one was a case study of one organization that put into place. And so based on that literature, here are some of the kind of key insights and recommendations that would be recommended from the literature. And I'm going to be asking in a minute, some of you may already be doing this. Co-design and adopt a shared network level performance framework, including a compact set of 8 to 12 indicators that are relevant and actionable across your multiple organizations. So there are some dashboards being produced by Ontario Health, and I'm not saying don't pay attention to those. I think that those are highly valuable. Currently, they're only being shared amongst a few OHTs, but I understand all OHTs will get access to them in the future. But understand some of those might be mostly relevant to you, but you might have other things that are really important to OHT. And I think this is the co-design element. So consider within your organizations. And then making sure you have a committee that has a delegated authority to look at scorecards, either monthly or quarterly performance review meetings that include a frontline representation to explain what's actually happening that drive those results. Ensuring that you embed patient-reported outcomes and experience measures and equity indicators. I strongly believe in this, and probably in the area of patient-reported measurement, if you're getting out there and things are looking different at the front lines, it's going to show up there before it's going to show up in a readmission rate or hospitalization rate for particular indications. Getting people's experience and thinking about that. Aligning contracting and funding performance expectations as much as within your power. I'll say it's an area of shortage within the survey. Most people say they're not doing a lot of that. And I also think most people would say OHTs are not yet fully empowered to do this fully, but this would be evidence. And finally, treating performance management as adaptive. Audit the work, iterate, and make your system proportionate to your maturity. So start off with something fairly simple if you're fairly new. And if you're more like, already have a not-for-profit incorporation, then, have a bit more of a sophisticated approach to doing this. And I think Kathy had mentioned their performance subcommittee of their governance board. So this would be some, and we're going to try and provide a bit of guidance here for all of you as you go forward. And in all of the domains in this, so I've just kind of picked out a few here. So I'm just going to ask, because it's our first time doing this, if this kind of material is helpful to you. So I've got a little bit of a poll here. Thank you very much for popping that up. So what do you think about having these kinds of suggestions? You think you're already doing them? Do you think that you think they seem like good ideas? Maybe you'll try them out. You're not sure, or you think actually I don't think for our OHT, for our context, that these are going to be useful to us. And just want to know a little bit about that before we put considerable effort into doing this work. So please do respond. I do take, and even if you're not in an OHT, think about what you think about these. I think we should get pretty high participation rate here. We're a little less than half of our participants, so that makes me wary. I'm sure everybody knows where the buttons are. Okay, I'm gonna close it off, and we can share these results back out. So some of you are already doing these things, and that's good. You're doing evidence-based models. And thanks for the chat, Humberto. Be nice to dive in and learn. So, hey, we will make them all available. And then others saying the suggestions are most useful. Some people saying don't think they do it, but I'd say I kind of have a little bit of the people participating today in this poll, that we have a little bit of a mandate to move forward with this work, which I think it's a stretch for us, but hopefully it'll be useful to all. We are at time. I was going to show a little video closing out if we had enough time. But what I'm going to say is I'm going to put a little search that I think you should do. Google search on Ross Baker, adaptive leadership. And the third one was the one that I was going to put up today on adaptive leadership. And I think there's a nice little video that Ross has. I'm not going to play it now. This is what it looks like online. And we make all of these available. And sometimes we do these little short clips. I think you'll be inspired if you go back and have a look at that. It was part of our June webinar. You can also see the content if you go back and watch the full June webinar content. But if you do that little Google search, you'll find it. We are here every month. Well, we do take holidays in December and August, but the fourth Tuesday of the month from 12 to 1:30, we'll be looking at equity measurement in October. And I talked about this study we've done of using performance reports and what we should be doing better. So we do try and look at how we do our work so that we can be continuously improving, and both at a high level, but also a bit of depth. So please come back. It'll be very interesting, I think. Also guidance to you. And we're interested in that discussion of how you can use the work and what we will do in our next iteration and our next generation of reporting on performance for Ontario health teams. Thank you very much for joining us, and hope you all have a lovely afternoon. Best wishes forward.